If you've been dealing with itchy, sore and swollen eyelids, especially when you wake up in the morning, you may be experiencing something called blepharitis. This is a very common eyelid condition. It's usually not serious, it's not contagious, meaning you can't spread it to other people, and for many people it can be managed really well with simple daily care at home. So today I'm going to explain what blepharitis is, the symptoms to look out for, what causes it, how to treat it at home, when medication is needed, and importantly, other eye conditions that can look similar and how to tell them apart. I'm Dr. Donovan, a UK licensed medical doctor with over 10 years of clinical experience. And just a gentle reminder, this video is for general information only. It can't diagnose you and it is not a substitute for seeing your own healthcare provider. So let's start with what blepharitis actually is. Blepharitis is inflammation of the eyelids, usually affecting the edges where the eyelashes grow. Symptoms often flare up, then they settle and they come back again, which can be frustrating. Common symptoms include sore or tender eyelids, itchy eyes, a gritty or burning feeling, as well as flakes or crusts around the eyelids. Some people also notice eyelids sticking together when you wake up. Now, some people also notice redness of the eyelid margins or irritation that feels worse at the end of the day. Now, blepharitis usually happens because one or more underlying issues are at play. It can be linked to naturally occurring bacteria on the skin conditions like seborrheic dermatitis, which is a condition very similar to dandruff, or the tiny oil glands in the eyelids not producing oil properly. Now, it's important to know that blepharitis, as I mentioned at the beginning of this video, cannot be passed to other people, so it is not contagious. Now, in terms of treatment, the cornerstone of treatment is regular eyelid hygiene, even when symptoms improve. Now, this really matters because blepharitis, as I've already said, tends to come back if the cleaning stops. Now, in terms of how you clean your eyelids properly, here is the usual approach I recommend. Firstly, apply warm compresses to the eye. To do this, you can soak a clean flannel or cotton pad in warm but not hot water and then place it over your closed eyelids for about 5 to 10 minutes. Now, this is going to help soften crusts and loosen blocked oils. Next, massage gently the eyelids for about 30 seconds using clean fingers. This helps to express the oil glands. And then clean the eyelid margins. Now, to do this, you can use cotton wool or a cotton bud dipped in warm water. Gently wipe along the edge of the eyelids to remove flakes and debris. Now, this could be done twice a day, and it's important to continue even when your symptoms settle. Now, while symptoms are active, it's best to avoid contact lenses and to avoid eye makeup, especially mascara and eyeliner. Again, a pharmacist can also help, and they may recommend eyelid wipes, eye pads, or lubricating eye drops to try and reduce irritation. Now, if symptoms don't improve or they start to get worse, that is when you should see your doctor. Now, a doctor may prescribe an antibiotic cream or an ointment for the eyelids. They may also prescribe antibiotic eye drops or tablets if complications develop, such as a cyst or an infection. Now, if blepharitis is severe, persistent, or associated with other eye problems, you may be referred to a specialist eye doctor called an ophthalmologist. Now, this is really important because not all sore eyelids are blepharitis. So let's go through some common conditions that can look similar, but how to tell them apart. Now, the first one is conjunctivitis. Now, this usually causes red or pink eyes, discharge that can be sticky or watery, and irritation affecting the whole eye and not just the eyelids. Now, conjunctivitis often does clear up on its own, but if discharge is heavy or symptoms worsen, then medical advice is needed to find out maybe what the underlying cause is. Now, another second cause is a stye. A stye causes a painful red lump on the eyelid. It's often tender to touch and usually affects one specific spot. Now, warm compresses often help, but if it doesn't improve, it should be checked. A chalazion can also be confused with blepharitis. Now, this is a painless lump caused by a blocked oil gland. It's usually not red or sore, and often needs no treatment, but persistent lumps need to be assessed by a health professional. Allergic eye disease can also cause itching and redness, but it usually affects both eyes rather than one, and often occurs along with sneezing or nasal symptoms such as postnasal drip or congestion, and improves with allergy treatments. And finally, more serious eye conditions can sometimes start with red or sore eyes. So please seek urgent medical help if you have eye pain, changes in vision such as blurred vision or vision loss, very red eyes, or a sensitivity to light. These symptoms are not typical of simple blepharitis and they need prompt assessment. And if you're unsure about any of these things, it's always okay to ask for help and seek care from your own health provider. For more reliable information on this topic, please check out the evidence-based resources that I've included in the description box of this video. And finally, you may want to watch this video next.